This could be printed on a piece of paper, or even on their smartphone, or even printed onto a card with a QR code or barcode on it, anything like that, and they can carry that with them. So the next day, the patient then goes to the clinic and visits that, is seen for a visit. At that point, what they can do is share the QR code that they received, that they registered for, and share that with the clinician or the registration clerk. And they can scan that, and the electronic medical record system is able to then access their, gain access to their health information and import it into that electronic medical record system. They're also able to secure that data via a PIN, which the patient needs to share to actually allow that to happen. So just in case that link is ever shared without the patient's consent, there's actually a PIN that also goes with it that's optional, that can also be help protect that the access to that information. So the electronic medical record, if it supports smart health links, you could scan that code and automatically import all the data that it receives. That data is received in FHIR format, but the smart health links protocol is used to actually download that data. If the system, so that's sort of the happy case where the electronic medical record does support this sort of exchange, but we all know that that's not always the case, and it's actually quite difficult to do those integrations sometimes. So as another option, instead of just importing the records, you can just choose to view them, which means with any old smartphone or any browser, you could scan the QR code or copy the link and just gain access to a viewer that's part of the Smart Health Links portal in the Health Information Exchange, and just view that data directly. So in that case, you're not able to import it into the local electronic medical record system, but you at least can view it and view the latest summary of that patient. So once that's the clinician at the clinic is able to, view the initial findings that the community health worker noted, they're able to assist the patients and perform a diagnosis and maybe prescribe some medications or something. They do that in the electronic medical record, which then also sends that data to the Health Information Exchange in the FHIR format. And once that's done, they conclude their visit. So the next week, we can imagine maybe they're back home, they've taken some meds, they're feeling a bit better. The community health worker decides to do a follow-up and comes to their household to see how they're doing. So what they can do at that point is check in on the patient and also, again, scan that same QR code that they originally created. And now the important thing to note is that that QR code links to live data within the Health Information Exchange. So every time you scan it, you're able to get the most up-to-date information for that, the most up-to-date summary for that patient. So they're able to again scan that code and see the outcome of the visits at the clinic, and see what medications they were prescribed, and maybe provide some advice to following through on a course of antibiotics or something like that. So once they do that, they're able to again see the summary of a patient and then guide them through the rest of their care. So this is something that is possible through the Smart Health Links portal. So essentially what it allows is the sharing of summaries, basically anywhere that there's a browser, but also you can choose to import those like directly into a system that does support the protocol specifically as well. So we think that's quite cool. So a little bit more about the protocol. There's a documentation page, and this is just a sort of an excerpt from that page. It describes the specification. So I'd suggest anyone that's really interested in this, give this a read. There's also some great videos on this that explains the technical reasoning behind it. And I believe it was originally prototyped by Josh Mandel, who's done some great work in this space to bring this to life. So props to him for all the work that he's done there. So this is, it's if you want the details of exactly how this works, have a look at this page. I have the link on the next page. So this is the actual link to um, that documentation. Okay, so just a little bit more about Smart Health Link. So it's a fairly new protocol. I don't see it widely used just yet, but I think it's very compelling. It basically works in a similar way to the Smart Health Card work that's been done previously that was, I think, adopted by many countries during COVID, where you can create this static card that you're able to scan and get health data from it. So that data would usually be in the format of a Fire bundle that you're able to, maybe assert that you had certain vaccines during the pandemic, for example. So it works in a very similar way, except it alters what you can actually share. So instead of being a static piece of Fire data that's encoded into a QR code, it can also just be a link. That's where the Smart Health Link part comes in. So it could just be a bundle of Fire data, but it could also be a link to where to fetch that Fire data. And it can also, the third part of that is it can also be linked to API access. So you can actually, through this mechanism, also provide applications with authentication to access data on your behalf through an API as well, which is not something we've explored, but it's also possible within the specification. I think one of the key things about this is that it also puts the patient in control of their data. So the patient being in control of their data means that they actually have to physically share that QR code with someone to give them access to this. So it's a sort of consent where you don't have to manage the consent through particular policies, but the patient is physically in control of what happens to their data. And not only that, they're also fully able to access and view their data and see what's, manage some of the data themselves. So I'll talk a little bit about that shortly as well. And then the last thing is this data is also encrypted by default. So all the communications have a particular encryption mechanism, and it can also be secured through a PIN. So those links are created to be difficult to guess, uses encryption, and are secured via a PIN that the patient holds. So those are some of the security measures that are provided through this mechanism as well. Okay, so just a quick view on the architecture. So this, I'm going to give a demo of this using our OpenHIM platform. So that's the suite of tools that we use to implement health information exchanges at GEMBI. So this is a sort of high-level view of a piece of that. So we have the health facility on the bottom left, sending in Fire data through the OpenHIM, which acts as our entry point into the health information exchange. We then have the data going to an MPI mediator. So this is some of the process that we do internally in our platform, which splits data between clinical data and patient demographics data. So the clinical data going to a Fire store. Typically, we use Happy Fire for this. And the patient demographics data going to a master patient index to do linking and matching. We have an internal tool called GemPR for that. And then what we've added for this demonstration, this prototype, is the Smart Health Links portal. So this is both a front-end application as well as a back-end service that manages some of the protocol aspects of Smart Health Links. And then the patient or community health worker deals through the portal, the web application, and the APIs of the Smart Health Links protocol to then view and retrieve that data. So in this particular case, this is sort of prototype work that we're working on. So most of this is correct, except we actually don't have the master patient index in the loop at the moment. That's something we're working on changing, but just for clarity, that's not something that's in the picture. It typically is, but in this Smart Health Links demo, it's not. So with that said, I think let's dive into a demo and see what we can show. Okay. So I'm just going to switch tabs. Just confirming you can definitely see my next tab.
Yes, we can see it, Ryan. Thank you.
Okay, good. Thank you. Okay, so what I have here is our OpenHIM application. So this is the entry points to a health information exchange that we've deployed using our OpenHIM platform. So just, I guess, a quick note about OpenHIM platform. It's basically, we had the OpenHIM technology, which acts as an API gateway to health information exchanges, and it's been around for quite a while. Our platform is based on OpenHIM, plus it adds a bunch of other mediators and open source applications like HappyFire, like our master patient index, and a whole bunch of other applications around OpenHIM that allows it to act as a more full health information exchange. So that's what we based this off of. And here we can see that through the OpenHIM, we've had we've been posting some FHIR data. So there's a bunch of FHIR bundles that have been posted through here and stored some patient's information. So this is just some FHIR data. You can see we're adding some immunizations in this case to a particular record. And basically what we have is a bunch of that has already happened. So we've loaded this health information exchange with some FHIR data already. And that's stored, so that goes through the OpenHIM and gets stored into HappyFire, which is a FHIR database, a FHIR server. So that's really there. And then what we also have is our Smart Health Links portal. So this is a bit bare bones at the moment. So like I said, this is prototype stuff, and we're hoping to improve upon it. But this is the portal. So this is something that's then patient facing. A community health worker or someone could guide the patient in registering for this. And then this is how they are able to gain access to their own data, as well as generate links. So if I click sign in the top right over here, it takes me to our single sign-on application, which is Keycloak. It's an open source application. In this case, I do have an account created, but I'm going to click register just to show you. So this is actually, we've allowed self-registration. So the patient can actually register themselves. They can provide a username, a password, give their email and their phone number, and they will then have an account within the Smart Health Links portal. So I've already done that. So I'm going to skip this step and just log in with actually, I'll do a new one. How about that? So I'm going to create a new one. So I'm just going to username Brian, email Ryan@Gemby. Give some details. I don't think that's required. Okay. So you can actually register yourself. What we do require is that that you actually need to verify your email address with us. And this is for a very important reason. We don't want anyone just signing up, for the portal and pretending to be someone that they aren't. So we have to do some authentication process to make sure that the person who signs up is the patient that we have data for. So the way that we do that is at the moment, so this can be configurable and it could be on a per implementation basis, but we require a verified email address. And that email address is then what we use to link with the actual health data, which also has the patient's email address stored. So that's the one way. And the second sort of verification of that is also in the next step of registration. We also require that a national ID be given, be supplied, and that must match the patient as well. So we're basically checking that the email that we have on file for that patient, this account has access to that email address, and that they can supply a national ID that's equal to that patient's national ID. So if I'm just going to go as an administrator and manually verify the email. So that's just an admin process. So if I refresh here, what you'll see is now that, so imagine that I went to my inbox, clicked verify, and that's what brought me here. I just did that as an administrator just to make it easy for myself because we don't have email sending enabled in this demo. So now the next thing that we get once we've verified our email is now you need to verify your user details. So we have a particular user ID that we can't edit. That's sort of internal, and then you must supply your national identifier. That must match what we have stored in the patient's record in the FHIR database. Once you've done this, so maybe enter something, and then that will then give you access to the portal and link you to that particular patient. So it's saying that you are that patient in essence. Okay, so I have a pre-configured one, so I'm just going to quickly switch to that pre-configured one. So I'm just evicting myself from being logged in. Okay, so what I'll do now is I'll log in as someone who's already registered. So I'm going to log in as Martin, who's already gone through the registration process and linked up there to a particular patient that we've already saved in the FHIR database. So once we do that, we're now in the portal. We can log in, and the first thing that you can do as a patient is view your summary. So this basically pulls out data from HappyFire, puts it into, in this case, it's into an RPS format, so International Patient Summary. It could be any summary format that we really define, but RPS, there's already some support for it in HappyFire, so we built it off that. But it can be, depending on your use case, you could decide on what the FHIR summary actually looks like. So once you log in, you're able to view your own details and the various different types of categories. So immunizations, for example, I can see what immunizations have been administered for this patient that we have stored in the Health Information Exchange. But here comes the part that's interesting, I think. So firstly, being in control of your own data is cool, but being able to share your data is even better. So we can come to this next tab for the dashboard, and then you can see that this is your shared links. So now you can actually manage sharing of this data. You can also start to control like what parts of the data that people see. So this is not something we've built, but something that's possible in the protocol. So you can say, maybe I only want to share immunizations. Maybe I want to create a link that I can share with a school to verify that my child is immunized. I can just choose to share their immunization record with somebody. Or you could share your full details, or that's an implementation detail. At the moment, we just support, in our case, sharing this international patient summary for a patient. So I could choose to create a new link. I can give this link a name. So let's call it that. I can give it a PIN code. So I'm going to give it the PIN code 1234. And I can choose to give it an expiry date as well. So after this expiry date, the link is no longer accessible. So this is a protection mechanism that you could put in place if you wanted to. If maybe you only want someone to be able to share your data or to view your data for a week, and you didn't want anyone to access it after that, that's possible. So I'm going to create this link. So here we have it here, a new one created, passcode is enabled, no expiry dates at the moment. And what you then get is the ability to have a QR code, which represents that data. So I'd like to invite anyone who has a smartphone handy, give this a try. So scan this if you would like. I'll leave this here for a few seconds. And if you're able to scan it, hopefully what you'll be able to do is you'll be linked to the built-in viewer for the portal, and you'll be asked for your name, like who's accessing this for audit reasons, and then the passcode, the PIN code that I entered earlier. So that was 1234 for anyone that's wanting to follow along with this. And I'll show you what happens next. So I'll just give a few more seconds if anyone wants to try to scan that. What I'll actually also do is copy the text-based link and put it in the chat if anyone wants to click on that as well, if that's easier. Okay, so I'll move on. So if I go open a new tab and I paste in this link, what that'll do is then bring me to this request access to patient data page. So I can enter my name, Ryan Crichton. I can enter the passcode, 1234. And if I submit this, I get the same access to the same data that the patient has stored in their profile. So this is a very easy way for you to share patient summaries for a patient, no matter what system the person is using, or no matter what system the clinicians are using, which we think is a really cool thing. Also, this link that we share doesn't have to just link to this viewer. It can actually also be used to import this data. So if you just ignore the viewer part of the link, you can extract a URL that you can use to access the FHIR data directly. And that's exactly what this web application is doing in the background. So it's just doing that with a default viewer, but you can also do that internally in an EMR application if you want a tighter integration with this type of sharing. Yeah, and then also, so if I just go back, so there are obviously some protections in place. If I enter an incorrect passcode, PIN code, it won't work. The data is encrypted as well. You can also go to, I don't want to do this just yet, but I can also deactivate the link. So for example, the AHIN one. I could deactivate that if I no longer want to share that with anyone, and then no one will be able to access it. I don't want it to do it now unless people, so people can still access it in the chat if they're still working on it. I'm glad to see it worked for some people. I'm seeing some chat messages, so that's great. Okay, so I think that's it for the demo. So now, just switch back to the presentation. I have a few more slides. Okay, so that concludes the demo. I hope that was useful. So we think it's really cool and a nice way to share these patient summaries and put patients in control of their data. So it's something we're obviously going to be building out into our own platform, OpenHIM Platform. This is a prototype. There's still a little bit of work to do until this actually is usable. If you are interested in our platform, you can check it out on GitHub. It is all free and open source. There's some documentation around it if you're interested. We have a community as well if you're interested in that, that you can join and come chat to us about. We're trying to get that community going. So please feel free. Like I said, this work isn't quite landed in the main branch on the open source application, but we do have some pull requests out to try to land this and get it all production ready. And that's going to be our goal. We just wanted to share the work so far because we think it's quite cool. Yeah, and I do also have a video. I won't. This is sorry. I'll stop that. If anyone's interested in learning more about our platform and other things it can do, they can also have a look here. I'm sure these slides will be shared after this webinar. And that's it. So I'm happy to take questions now, and I hope that was interesting.
Yes, thanks for the presentation and demo of OpenHIM, Ryan. This is truly helpful, especially to those who aren't familiar with OpenHIM yet. I'd like to invite our participants to ask their questions. You can enter your questions in the chat box or in the Q&A box. We also enabled the microphones. So while waiting for the others, let me start with the first question in the chat. It's from Dr. Asif Atik. Is there any public site or documentation on it?
Yes. So on the protocol itself for smart health links, there is. I did share that in one of the. Here, this link. Oops, sorry. This link here will allow you to access the documentation on smart health links. Otherwise, a Google search on smart health link docs will do the same. But yes, there is lots of documentation about the details of the protocol which can be used. And all that we did is use that great work and implement a portal on top of it. That's also open source. And we can share the link to that. It's just not completely complete just yet.
Thanks, Ryan. Our next question is from Dr. Mohammed. Is there any mechanism to see who has access to data?
Yes, so there is, and that's part of the reason that you enter your details before when you click on the link. Um, you can actually have an access log of who last accessed the data. It's not something we have a screen built for in the user interface at the moment, but there is an example of this on the Smart Health Links documentation page. The original prototype that Josh Mendel worked on does exactly that, and you can see um, who's accessing it and how often, and when they access it, and all that, which I think is a really handy feature and something we want to add as well.
Our next question is from Dr. Malinda. Can you control the granularity of data exposed?
Yes, you can. So again, not something we've built into this version of the portal, but something that's possible via the protocol. So you can choose what parts of what parts of the summary you want to share, or what parts of a fire bundle you want to share. Um, it's quite open, so you can definitely. So you could imagine a more complete portal where you could have a few different options. Maybe the patient wants to create a link just to a summary record, or maybe they want to create a link to all the medication they're currently taking, or create a link just to the immunization records that they're taking or that they have. Or maybe they want to create a link that has access to everything, has complete access to all their fire data that's stored on a fire server somewhere. All of those things are possible.
Thank you, Ryan. Our next question is from Dr. Alvin. Is it possible for the patient to trigger the Smart Health Link QR code generation?
So yes, it is. So I mean, they will be the one that is able to access that portal themselves as a registered user, and create those links themselves, and then they could use their accounts with the portal to access that data as well, and manage the QR codes, the links that are generated, which are the QR codes.
Our next is from Dr. Samiksha. If I have understood this correctly, patients themselves can control what they want to share. The question is, can health workers also ask patients during registration and categorize specific data if they're shareable or not, since all patients cannot and will not be able to control their data accessibility?
So that's a good question. I don't really know the answer to that. I'm sure it would be possible in terms of like something that could be implemented into the portal to allow clinicians to request certain pieces of um, the patient's data, and then they could approve that. I guess it'll just be an additional workflow built into the web app that supports that. So I don't see why it's not possible, but I haven't. It's not something we've specifically thought about.
Thanks, Ryan. Our next question is from Sir Keith from Anzil. So, are you using Snowmed CT for IPS in the records?
I'd say probably, but I wasn't. I wasn't the one who actually coded this, so I can't tell you for sure. We did stick to pretty standard RPS, so I guess the best answer I can give is probably.
Yes. No, thank you, Ryan. We have a question from Engineer Derek Ritz. So the EU is looking at this SHL or VHL for sharing patient summaries. Have you explored digital signing and or issues regarding data subsetting by the patient?
Yeah, in terms of signing, I'm trying to remember exactly, but I think there is a signing process that's specified in the protocol. Um, I don't remember if it's optional or not. So we might already be doing that if it's non-optional. I don't remember exactly. In terms of data subsetting, um, yeah, I mean definitely that. I think that's one of the key important things about this is really allowing the. Derek, do you want to? I see your hands raised. Do you want to talk to them?
It's just an issue that came up, Brian, if the patient summary is being shared for the purposes of care delivery. It was there were voices raised at a meeting recently that it would be important for the clinician to know whether or not the patient had decided to invoke their rights around consent and had omitted some of the information. And it just was raised that there should be some way for the clinician to know whether the patient summary is a complete patient summary that they would have got from the Ministry of Health's shared health record, for example, or whether or not the patient had omitted some of the content. And one of the ways to operationalize that, of course, is with digital signatures. But it was a very interesting flip side to the patient empowerment and the agency that we want patients to have. But on the other side, clinicians have a medical legal responsibility regarding their care, and an important need to have either full content or to know they should be asking for more if things have been intentionally omitted from the patient summary. Over. And Brian, great to hear your voice, my friend, and what a good presentation you're making. This is wonderful stuff. Thanks. Over.
Yeah, same to you, Derek. Great to hear your voice. Yeah, that's a good point, and not something we've specifically tackled as of yet. So we're really getting started with this stuff, but I think it's very compelling, and I'm sure those sorts of things can be ironed out with sort of a representation that at least tells you that you're missing some data or the data was omitted. I'm sure there's some way in FHIR that we could do that, and tacking that on to this would be no trouble. Since this is really the smart health links part is really the plumbing to the semantic part, which is FHIR.
Thank you, Sir Derek and Ryan. We also have another question from Dr. Alvin. So, with the upcoming WHO Global Digital Health Certification Network, how can it contribute to smart link generation?
I think that's a good question because I'm not really sure. Yeah, I don't know, Alvin, exactly. So it might have a good role to play, but I don't have a good answer for you at that stage. It might be something that could be found to be a useful protocol for that, but I can't be sure.
Thank you, Ryan. We can move on to the next question from Dr. Thep. He's asking, how many hospitals have implemented this project, and what's the main challenge that you had?
Sure. So at the moment, this is not implemented in production, at least by us anyway. I'm sure it has been, well, I'm not sure. It possibly has been by others. But this is something that we'll see on the roadmap for things that we want to bring to some of our partners that we're deploying health information exchanges in their networks. So we'd like to bring this into production, but right now there's nothing that we're doing. This is all prototype work for us and exploratory work that we thought was worth sharing, and none of this has gone yet to production and is not production ready, to be honest, just yet. At least from our side, I think the protocol and the actual specifications, I have no problem with. We don't see any major flaws, or maybe some of the things that Derek mentioned that might be worth looking into in terms of making sure that we can indicate if a record is whole or not. Maybe something baked into the protocol would be good, but as a base, it's been really good for us. We found it easy to work with, and it wasn't too onerous for us to implement.
Thank you, Ryan. Our next question is also from Dr. Alvin. So, is there really such a thing as complete summary, or just complete within the repository but no attestations about other repositories?
Yeah, good point. So, I guess no, there isn't such thing as a complete summary. Otherwise, it would just be the full FHIR data. So, I think a summary is, I think in terms of completeness, I think what Derek was really getting at is that there could be potential very useful information that could be omitted that might be included in a summary, but the patient chose to not allow. Maybe, I guess the common example of this is maybe an HIV status, for example, that it can be a sensitive topic, or maybe there might be other diseases as well that might be sensitive. And it might be very important to know that facts for a clinician, and having some sort of way to know the data is missing is an important thing. But yeah, I think when it comes to summaries, I think, especially in what we're trying to do, it's supposed to be a summary. It's not supposed to be the full medical record. It's supposed to be for at least getting some sharing of health data between facilities, not necessarily the go-to for the complete data about a patient.
We have a new question. So, can we have hands on using your test server in a future session?
I don't see why not. That should be something that we could support.
Just first of all, to reiterate, thank you for this really compelling demo, Ryan. I'm sure I speak for everybody on the call to give you compliments on having done such a good job and to introduce this interesting topic for us. I mentioned this in the chat, the Hajj use case, which WHO was supporting with partners this last summer, or last, I think it was June, maybe was the Hajj, and I apologize if I've got that timing wrong. But it is leveraging something called the VHL, the Verifiable Health Link. And the difference between the VHL and the SHL is that you can leverage a PKI signature on top of the QR code and show that this is a link that is pointing to a Ministry of Health patient summary, and the Ministry of Health's signature is on top. And that was intended to establish a trust network that could be used to say this is a patient summary that includes all of the data holdings that the ministry has, and that they're digitally signing on top of that. It's very interesting to me the ways that this notion of digital signing adds a trust layer on top of the use of an SHL for care purposes, for clinical purposes. And that was why I was asking whether that discussion came up with your Kenyan teammates. The work around VHL, it's going through and now an international standards body. So the IHE Technical Committee for IT Infrastructure is working with WHO leadership to kind of solidify some of that. And also just a shout out, I noticed when I was looking at the content, Ryan, that your QR code pointed to. If you go to the organization, you'll see that it's the University of Cyprus, and there's some folks at the University of Cyprus that have been working very closely, I think, with Josh Mandel and helping progress this. And they were at a conference I attended, or a retreat I attended just a few weeks ago around the European Union and their anticipated use. So there's, I think, a lot of momentum around shared health links, or the digitally signed shared health links. And I agree with you completely, Ryan, that this is something that is addressing challenges that many of our ministries of health are facing around how to empower patients and how to address some of the consent management challenges that there can be around data sharing. And I really think Smart Health Links is a very rich area for us to be exploring, all of us. So thanks again for the great presentation. Over.
Thank you, Derek. And I agree. I share your sentiments on that. And it's very interesting about the VHL. That's not something that I've encountered. So definitely going to put that on my radar to look up as well, because that sounds like it would be very useful to us as well.
Thank you, Sir Derek and Ryan. I think there's a question about VHL, Sir Derek, from Dr. Alvin. So it means the MOH will then be a registration authority and give a certificate to an OpenHIM implementation that generates the Smart Health Link.
It could be that. I mean, certainly that is one way that you could operationalize it. I'm not sure whether or not that was how it was operationalized for the Hajj use case. I think they were leveraging the digital signing infrastructure that was used in the European Union for their COVID QR codes. I think they used that as their way to say, if I've got a QR code, can I establish who is the originator of the QR code? And in the same way that was used for COVID certificates in the EU, they used the same mechanism, or that's what I understand they did, Alvin.
Great. Thank you, Sir Derek. It seems that's the last question for our session. So again, we'd like to thank Ryan for the presentation and demo, as well as to our participants for actively participating in tonight's session. We hope to see you again in our upcoming webinars. Thank you, everyone.
Thank you, Chad. Thank you, Ryan. Thank you, Derek.
Thanks,
Good night,
everybody.
Thanks all.
everyone. Thank you. Let's have another session, Ryan. Thank you.